What about tricuspid insufficiency? Well, what would be the etiologies of that? Well, one of the most common things I see is if you have papillary muscle dysfunction. And why would you have that? If the baby had a very distressed delivery and suffered some ischemia or hypoxia, the endocardium on the right ventricle papillary muscles has suffered some damage and they end up with tricuspid insufficiency. That will usually get better over time, but that's one clue. Atrioventricular canals, that single AV valve, or if they have two, they can still have dysfunction of those valves. Endocarditis, that's another. And something called Epstein anomaly. We'll talk about that in a minute. But remember, if you see that, associated with lithium. Whether that's true or not, we'll find out as time goes on. You'll hear a blowing, regurgitant, or holosystolic murmur at the right lower sternal border, right near the xiphoid process. They'll have an enlarged liver and jugular venous distension if it's severe insufficiency. And then your ECG and chest x-ray will show right atrial and right ventricular enlargement. Now, what about this Epstein anomaly? Well, this is what their x-ray looks like. If you see in a neonate a wall-to-wall heart, it's Epstein anomaly till proven otherwise. And what Epstein anomaly is a depression. The tricuspid valve doesn't insert in its normal position. It's depressed into the right ventricle much lower. And therefore, they've got this giant right atrium. This valve often doesn't coact right. They've got a lot of tricuspid insufficiency, and they can even be somewhat cyanotic. Count that under the tricuspid atresia group of T's. Because they don't have very good forward pulmonary flow. They almost always have an ASD, and they have a right to left shunting through the ASD, giving them the cyanosis. You treat that by trying to lower your pulmonary vascular resistance, and if you can get them by with that, that's fine. Later in life, sometimes they can tolerate this. Other times they need surgery to try to resuspend the valve or put in an artificial valve or something like that.